In this scenario, the patient is very close to being on. However, there's still some supine positional variation in the bony pelvis. We're thoughtful about overpositioning as there's a risk to throw the patient off further, but we know that they're not in position here either. This technique stays ipsilateral, so it's very effective to adjust the pelvis without impacting your partner. It will also quickly tell if you're not as close as you think, and spending the time to accurately position is necessary. There's an invisible line that runs down the middle of the patient, separating left from right. When you stay inside of your half of the patient and don't cross over the middle, we call that ipsilateral positioning because it does not change your partner's side of the patient. This technique repositions the way the patient's anatomy sits, so you can very quickly and accurately achieve moves approximately 1 to 3 millimeters. You can see that my partner is on, center is on, and straightening is on. On my side, the tattoo is about 1 millimeter anterior, meaning that my side of the pelvis and femur are sitting slightly anterior. You can see that the heel of my hand is going to sit on the patient's anterior bony pelvis in the muscle superior to the greater trochanter, and I'm going to relax the patient's muscle or that tension directly posterior. It's important to have the heel of your hand on the muscle for this move, both for the patient comfort that the heel of your hand provides and the accuracy of the movement. You should adjust your pressure depending on how much motion you need to see that the tissue and the mark move in a very controlled manner. You should not be pushing into the hip, which would cause the full pelvis to move laterally. You want to be controlling the relaxation of that muscle in the pelvis and the leg posteriorly to create a fall in the pelvis instead. Sometimes gently holding the heel in the muscle or a gentle shake will also help relax that muscle. This technique preserves the marks on the top and on the contralateral side. Remember, because you're keeping the movement isolated to your side, you'll want to move the full distance required for this position.